Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Nowadays, it is trendy and has become common practice for people to move around with earphones and headsets. But also, increasingly, the cities we live in are becoming much more noisy to levels experts think are harmful to our ears. For a fact, the World Health Organization has projected that globally, 1 in every 4 people will be living with some degree of hearing loss by 2050. This will translate to 700 million people requiring access to ear and hearing care and other rehabilitation services unless action is taken. Dr. Christopher Ndolerire is an ear, nose and throat surgeon.
Because of probably drugs that affect the ear, probably an infection like TB, and I take still the drugs and I don't hear. In children, they can get measles, they will not hear. So it is a range of causes, but hearing loss is not particular part of people. If, you and me and the rest of the world can have hearing loss. You can get it congenitally as you're being born, or you can acquire it. And acquiring doesn't have any age, whether young or old.
Makerere University, where Dr. Ndolerire works as the ENT head of department and senior lecturer, has been conducting some studies to guide policy formulation on tracking and finding cases of hearing impairment. He says though the studies are not yet finalized, they put the prevalence at 10 and 11% for the young and old people in Uganda consecutively.
If you counted 10 people about here and one of you is having hearing impairment, then it's a problem. That's every 100 people you're having people with a hearing problem. We are talking about the broad spectrum of hearing impairment, from the mild cases to the severe cases. You get the point? When you put it broadly like that, whichever degree of hearing impairment you have will affect your day-to-day production in life. Okay?
Hearing loss may be mild, moderate, severe or profound. It can affect one or both ears and leads to difficulty in hearing conversational speech or loud sounds. In children, nearly 60% of hearing loss is due to avoidable causes that can be prevented through implementation of public health measures.
Many of the infections acquired during pregnancy, even if they are mild, for instance like rubella or other viruses, they can affect the kids' hearing, and we should keep this in record and test the kids once they are born.
But after that has happened, then we encourage mothers also to attend immunizations.
Likewise, in adults, most common causes of hearing loss, such as exposure to loud sounds and octotoxic medicines, are preventable.
We see lots more and more of kids getting very early on hearing loss because of these earplugs and exposure to noise, to recreational noise.
But we encourage them to do yearly checks or biannual checks for those who work in environments that don't have a lot of noise. Now, if you work at the airport, if you work in the factories, if you work road construction, like hearing levels beyond 100 decibels, then for you, you should have, before they employ you, they should check your ears so that they know they are right, and you should have protection for your ears during your work, and you should have yearly checks for your ears.
Dr. Christopher Ndolerire is leading this team of specialists at International Hospital Kampala to conduct surgeries which will help children regain their hearing sense. The surgeries involve providing hearing implants to stimulate the hearing process.
These are given to children who are actually have been failed to be aided and are actually between severe, profound and deaf ears, coming to deafness. So these people should be able to have cochlear implants. And we do them mainly in children, but even adults can receive them.
It is also important that such people are taken to speech therapists after surgery.
As a speech therapist, you come in to develop that speech and language, and also the listening bit of it. Because with the gadgets they've received, they need to be trained to use them in their listening. It's not a matter of that they are hearing this, hearing that, but we need to train them that when you hear a knock on the door, when you hear a certain sound that sounds like this, that's a knock on the door. So it takes a lot of training.
Dr. Mostafa says the implants should be carefully taken care of.
Implants are extremely expensive devices and they are extremely delicate. It has to be guarded against external trauma. You have to take care that it is not dropped, it is not directly hit, it does not fall off the head of the kid or of the adult wearing the implant. You have to make sure that the batteries are in place, the cables are in good condition.
Gaston Moramira, who imports the hearing aids, explains how one can get a replacement in case of damages or malfunctions.
We have the people who are working with the audiologist. We look at replacing it. We have the replacement processors. We have like 2 or 3 in the offices. We give you a runner, we call it a runner. We give you for the temporary, we give you hours, and then we take you as back for servicing or cleaning up and see what is the problem.
About 466 million people around the world have disabling hearing loss, comprising 432 million adults and 34 million children, impacting on their quality of life. The majority live in low and middle income countries. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities